All right, Kyle Mack here, and I'm sitting here with Dr. Hanna, and today we are talking about a topic that is important to him.
It is. So, today we want to talk to you about, are you ready for this? Marijuana. That's right. This is an important topic. I've been in practice since 2002, and I've come to realization that my whole approach to how I think about marijuana has changed. When I think back to the conversations I used to have with the high school, college students that I used to see, and what those were like, and the conversations I'm having now, huge shift in my approach. So that's what I want to talk about.
Yeah, I'm excited to hear.
Do you have any thoughts on marijuana, Kyle?
Oh, certainly. I mean, I'm coming from working in dual diagnosis programs where I had plenty of people that were struggling with mental health issues and self-medicating with marijuana. You know, I've seen the
You might want to explain what dual diagnosis is, because
Yes,
I think
sorry.
not everybody probably knows what that. I think those of us in the medical world know what that is, but my
Right.
guess is most people don't. So.
Right, so co-occurring. So they're simultaneously existing, kind of the chicken or the egg in some cases, but you have a addiction or substance abuse issue in addition to a mental health condition, diagnosis, illness that are both having an interplay where one might be causing the other to be more significant and severe, which has been my experience predominantly with marijuana, where significant marijuana use would make a bipolar manic episode that much more severe, or somebody's anxiety might be temporarily managed with marijuana, but then later on, maybe 6 months in, becomes that much more severe because of the, I don't know, I would say compounding effects, but the latent effects of marijuana built up in their system. So I've seen a lot of people that say, hey, it's a non-issue for me. It's part of my normal routine of managing my anxiety, specifically even my depression. But oftentimes I was seeing extreme cases where that was single-handedly really messing with people's lives, and that was really tough because I'm sitting there saying, you know, there's this cultural norm of this is a harmless drug relative to all the others, but then I was seeing pretty significant implications upon the work that I've done and that we do here.
Yeah, and our goal of this conversation in this video is we're not talking about legalization. I'm not getting into any of those conversations, and about political and legislation and the business of marijuana or any of those things. I want to have a conversation really as a clinician, as a psychiatrist of what it is I see and how I've changed my approach. So if I want to go back to 2002, I'm new in practice, and I get all these kids coming in who are smoking marijuana, who are doing it. My approach was typically like this. This is illegal. Stop. You're going to get in trouble. You're going to get arrested. And this will be really bad. Well, I discovered pretty quickly that A, they didn't care, because a lot of them were not getting in trouble, honestly, at least in the community that I was part of. They were not getting caught, and they would talk about how careful they were, and they would never do marijuana and drive, and they were never outside with it. So they were not getting caught. So in a sense, I was wrong. I was trying to point out negative legal consequences because it was illegal, and it was not very effective. And this would frustrate me. Like, don't these kids care? What is wrong with them? They're going to get arrested. They're going to, and for them, it was like, but I'm not getting arrested. No one's getting in trouble. So clearly the whole sense of the legality of it, which does lead to some of the states approving it and all sorts of things, but it wasn't effective anyway. And I found that talking about potential negative legal consequences was not really effective. And the more I thought about this and the longer I stayed in practice, I realized actually that wasn't even the issue. That if we're going to have an honest conversation about marijuana from a psychiatric perspective or from a clinician therapeutic perspective, or even just as a society, we need to understand that whatever it is we do, right, whether it's having a glass of wine, having a couple beers with some buddies, or smoking weed, there's a purpose to it, right? There's some sort of motive. And as Kyle just alluded to this, people do marijuana for all sorts of reasons, for many, many different reasons. And you could talk about it, and I'll let you kind of talk about that a little bit about.
Yeah, I mean, we when I work with patients, it's always the first question out of my mind, or the first thing I say is, I'm not here to judge, I'm here to assess. I want to understand your relationship to your drug of choice, to your drinking patterns, rather than label it as good or bad. And one of the things that I always put forward is that my experience, when there's a problem that is associated with use, it's usually because you're trying to use for reward or relief. One of those two silos, and that's, I think, probably what you're gonna
and a lot of times I see plenty of kids who will say, and I think they're being genuine and they're being honest, that they're not doing for relief. They like it.
Yep.
They genuinely like it. They like how it feels. Now, I've pointed out to so many of them, if they didn't like how it feels, they wouldn't be doing it. That's kind of an obvious, right? If I did not like dark chocolate, I would not eat dark chocolate. For those of you who are listening, I like dark chocolate. And I love cheese too. And it tastes really good. But putting that aside, so obviously, if you don't like the high, you would not do it. Right. And so then that's a very different type of conversation when we talk about someone who says, I just enjoy getting high. It's not that I'm doing it when I'm anxious. It's not that I'm doing it because I'm depressed. I just gotta like it. And so that changes the conversation, because there's a huge difference between I feel so nervous all the time and I can't relax and I smoke weed and it relaxes me, versus hey, this is just kind of what we do on Friday night and Saturday nights, whether on college campus or a bunch of, if you're watching this and you're in your late 20s and you're just like, every once in a while, it's not something you do every day, or it's not even something you do every week. You just like getting high. And I realized that whether it's for myself about eating chocolate or having cheese, or for other folks who like getting high, it's the why. What is my motive?
Yeah.
Why do I do what I do? And I've come to the conclusion over the last few years that if we're going to have this conversation, we got to talk about what is wise. Is this wise for me to do this? And why am I really doing it? Because I want to shift the paradigm from legality to, I even hate to say it, risks, benefit versus risk of what could go wrong, right? And we can talk about that, and maybe that'll be for another video. But at the heart of this, it's a wisdom issue. Is this wise? And to be honest, I think in our culture, we've lost the sense of making decisions that way about all sorts of stuff. I've said this line to probably several patients over many years that, and hopefully this will make sense, but I don't have a designated bedtime. And what I mean by that is that it's not like my wife says to me, you must get in bed by 11 o'clock or you're going to be in trouble. No, right? My kids don't have a bedtime for me. I don't have a bedtime. I'm an adult, right? However, staying up till 2 or 3 in the morning would not be wise.
No.
Even though it's legal, right? I'm allowed to, right? My wife does not monitor my bedtime. If she did, that would be a problem. I don't monitor her bedtime either, by the way. But it's a wisdom issue. It's probably not wise for me to stay up till 2 or 3 in the morning every night watching YouTube videos like you're watching right now. Because I got to get up in the morning and I got to function. I got to think clearly about my patients. I got to make good decisions. It's a wisdom issue. And I'd like to steer the conversation. If we're going to talk about marijuana, is it wise? And by the way, so I did not tell Kyle where I was going with this conversation before we started on purpose. Because I kind of wanted to get his reaction to what I'm saying, because this is how I'm seeing it, and this is how I'm trying to frame it for myself and my patients. I have no idea how you feel about what I just said, or what you think of it.
I can definitely resonate with the wisdom, but before I even get to that part of the conversation that I've had with my own patients, I often think about, I go back to that reward or relief piece, and you're absolutely right. Not everybody goes in with that intention.
Yeah.
Sometimes it is an innocent intention. Sometimes it very much is a experimental, just hanging out, having fun, trying something new. And I tend to not skip over that. Like, I don't dismiss it. But I don't take issue with it until I start to see a pattern or something that is along the lines of like defending the often negative consequences or dismissing the negative consequences that we're always watchful of.
And that's the part we interact with on a regular basis, right? We interact with the negative consequences all the time. And a lot of people actually outside of our world don't realize that.
Right.
A lot of people don't realize that we get to live with so many of our patients all the negative consequences.
Yes. But before it gets to those negative consequences, that's where I start to have that wisdom conversation. So I have a lot of patients that will come in and they will say, Kyle, I promise you, this is not an issue for me. And this could be spoken about, alcohol, it could be spoken about lots of other recreational drugs. I don't even know really what fits in that category anymore, to be honest, but when we're talking about marijuana specifically, they'll say it's not a problem, it's occasional use, I have it well under control, I haven't had any exacerbation of symptoms because of it from my own observations. So I'm like, okay, I will trust that for now, and we'll talk about it when the need arises, if the need arises. But then I talk about wisdom, and I sit there oftentimes with young adolescents or young adults, college-age students, and I say, but we're still taking a risk. We are still playing almost like a game of Russian roulette. And I look at this from the research that I read, the things that I've experienced and witnessed in a variety of situations, whether that's inpatient or outpatient programs, where there's that chance, right? How big, how small, it's hard to say, that use can trigger early onset of symptoms that may not emerge until much later, or may potentially never have emerged, and that terrifies me.
Yeah.
Now, this research is often controversial, but it's out there, and when I read that, it's like me reading up on something that says, if you choose to do this, you could be scot-free, totally fine, or you might be opening yourself up to really, really messing with your genetics and how that different things express themselves. And when we're talking about what we're talking about mental health issues, anxiety, depression, bipolar disorder, severe psychosis, things that really rock your world, and can impair your functioning. I look at it as, is it really wise to even take that chance?
Yeah, and that's a really good point, because I'll tell you where this is kind of a wisdom issue. So someone is coming to see me because they're depressed, and they're saying, hey, I hate how I feel. I'd love to, can we consider an antidepressant or something like that? And they're smoking a lot of marijuana. And so the hard part for me as a clinician is I want them to feel better.
Certainly. Right?
I want to help them. But that's where smoking the marijuana in that context is a wisdom issue. Is this really helpful? Is this going to counteract everything I'm doing? And a lot of times I get frustrated, and if some of you who are my patients watching this, I get frustrated because I feel like I'm trying to help by doing something, but there's something else counteracting it.
Yes.
Right? And so, and then you get frustrated if you're on a medication, you're smoking weed, and you're not getting better. Well, because the marijuana is going to negate some of the potential benefit of the medications.
But it's hard. It's hard to trust that.
Yeah.
And it's hard to, especially if it's a habitual usage pattern, it's really hard to cut that out. To say, hey, you know what, Dr. Hanna, I'm going to trust that. I'm going to work my way off. I'm going to abstain for a period of time, and then I'm going to see how I feel. Yeah.
And I don't get a medal for them stopping weed. Like, no one's paying me $1 for every patient I get to stop weed, right? To stop smoking weed, right? And I tell them, I go, listen, it's not like somehow I'm benefiting by you not smoking weed. You're the one who's struggling, right? And I want you to feel better. And can you trust me that if we want to try a medication, that we can remove that variable, right? And I think it's hard, right? Because it is hard to stop. And that's a whole separate conversation about when people can't stop. Right.
And we will definitely be having that. But I
Right.
think back to the wisdom piece is that, you're talking about patients who are saying, I would like to consider an alternative way of treating whatever they're presenting with.
Yeah.
Often, they're looking for a medication.
Mm-hmm.
And where I look at it as a clinician, not a prescriber, I say, is it even worth going and experimenting with a medication before you've carefully considered how you might feel and how you might function when you're not using, when you're not smoking?
Right.
And it's hard because wisdom, being wise about this, would say, like, let's at least try it.
Yeah.
Let's try abstaining and seeing how we begin to function. Given enough time, I know there can be, 90 days, even as far as 6 months, where I've worked with people that said, hey, I've been clean and sober for 6 months off of this drug or that drug and marijuana, and now is when I'm starting to really feel different. I feel like my brain is like so clear, and I'm like, this is amazing, and that is what hooks them. That's what convinces them, wow, this is worth it. But I say, isn't it wise to try that before we explore some other medications? And now that's again a clinician's perspective.
And the interesting thing is, the path to wisdom is countercultural. What I mean by that is that I think we're so programmed to avoid discomfort, to do what's pleasurable, and to do what feels good. And we want instantaneous results.
Right.
So the path of wisdom requires patience. It requires sometimes having to struggle as you're stopping the weed, and you might even stop it for 30 days and not feel different. You're like, what's the point? Why am I doing this? This is stupid. That Hanna doesn't know what the heck he's talking about. He just wants me to stop weed. Oh, what an idiot, right?
And if you're my patient, you hear a lot about discipline. It takes a lot of discipline to get there.
It does. And again, so the path of wisdom a lot of times looks different than we think, right? It's not going to have instantaneous results. We're not going to see, there's not going to be that immediate gratification. You might not feel better right away. It does require saying no to doing fun things, right? I've had this conversation with a lot of people about, well, what am I supposed to do on Friday night and Saturday night?
Yep.
This is what, Dr. Hanna, this is what we do in college.
Yep.
That's hard, right? Because being social is natural and normal and appropriate. Being with friends and having that desire, that's good, it's healthy.
Yep.
But what if that's what the activity is? That's really tough. So then what does wisdom look like there?
Right.
And again, it changes for each of you who are watching this. As a parent, if you're listening to this, what does that mean for your 16-year-old, right? Who you know is doing this. Is it wise? What does the path of wisdom look like as a parent? What does the path of wisdom look like for your son or daughter?
Yeah, and I would say, let's face it, it comes at a cost.
It does.
There's often a social cost. Sometimes there's a cost of, maybe there is a benefit that you have identified that maybe comes with more consequences than is worth it, or more consequences than you can see until it's out of your life. But it comes at a cost. Maybe you need to be more creative. I mean, I have these conversations a lot. I might be a little bit blunt, but I'm sitting there saying, if this is the only way you know how to have fun and the only way you know how to socialize, we got a lot of work to do.
Yeah.
Because if in my clinical opinion and personal opinion, if your socialization revolves around a drug or a drinking activity alone, and you cannot function or hang out or spend time with people without that being the common denominator, I think there's a huge problem with that. And unfortunately, I see that often because when the scales do tip, when there is a dependency, when there is that full-blown addiction, whether we like that wording or not, where there is that relationship that is so significant, all of a sudden, all of your fun, all of your socialization, all of your community has to change. Yeah. And that's terrifying for me.
That's really hard.
And I really have a heart for working, with anybody struggling with substance use, but it is so painful to see people say, I can't hang out with anybody that I care about, anybody that I love, because I can't handle myself in this environment, because if I use, I fall apart. If I use, I decompensate. Yeah. If I use, my mental health symptoms are going to control me.
And that's tough. And nobody who starts using thinks it's going to become a problem.
Right.
Right? So, I'll see kids who started experimenting at 13, 14, and some at 16, 17. No one ever thinks it's going to be them who's going to have the problem, right? No one ever thinks it's going to be them in an emergency room with a head injury because they were drunk and intoxicated, right? Nobody thinks it's going to be them. Nobody. That's the whole kind of, I think, sometimes not anticipating risk, and I think part of growing up, I get that, right? When we're younger, it's hard for us to anticipate risk, and that's part of maturing. But I think part of our job as parents is to recognize that in our kids, our teenage kids or our college students, and to have these conversations. And not to be afraid to have them. I think I would say that back to the path of wisdom as a parent, to not be afraid for your kids to be different. That the whole notion that this is what college students do, that this is what it means to be a college student, I think we need to step back and rethink that one. Because that's just falling into the trap of doing what everybody else does.
Yeah.
So.
And that's a whole other issue, but
Yeah.
that's a perception issue. I mean, you go to any college, you can get statistics, you can look at it from a number of different organizations that compile this data. The perception is that everybody is drinking, everybody's using, everybody's doing these things. And while I will yield that it is a
Large
good
percent,
chunk of people, you're talking 30%, 40%. Now, again, that's not binge drinking, that's not excessive drug use. That could be, experimenting with drugs. That could be, drinking more than one time a week. There's so much data out there. But the bottom line is, even the extreme cases and the data that's out there, or even the very broad data, like anybody could fall into that category, there's still an overwhelming amount of people that are not partaking, that are not participating, that are not involved in those types of activities. So that's where I want to say perception is a huge problem. We live in a culture where we're inundated with a lot of imagery, a lot of, this is the cultural norm, when in fact, that's not often the case.
Yep. And so, I want to finish up with one last thought on the path of wisdom is not going to come naturally to you, whether you're the one who's smoking the marijuana or you're a parent of a son or daughter who is. It doesn't come naturally. It does require a very different countercultural approach to life. And if we're going to have this conversation about marijuana in our culture, we need to realize that we need to be thinking of a wisdom paradigm, not just a strict, is this good, is this bad?
Right.
Right. So hope that's helpful. And we will probably revisit this topic again in multiple ways and, multiple angles.
Definitely. And the challenge is you need to get as much information to make sense of this very complex and difficult to address issue.
Yep.
All right. Thank you.